Hello, my name is Lawrence Ayers, and my project was addressing childhood obesity in southern San Diego County. First, I'd like to give some quick background information. The Scripps Mercy Chula Vista Wellbeing Center developed a program to help expose local high school students to healthcare careers. The program is named the Health Career Opportunity Program, or Camp Scripps, and is a 6-week camp held at Scripps Mercy Chula Vista Hospital, located in South San Diego County. Camp Scripps took several incoming 11th and 12th grade students and introduced them to various medical professions. During the camp, students engaged in numerous activities such as surgery viewings, resume building, project management, clinical workshops, and health education. And one of the main topics in the health education portion was childhood obesity. The purpose of this project was to first, decrease the prevalence and spread awareness of childhood obesity by educating high school students on healthy lifestyle behaviors. Second, we wanted to survey them on their current eating habits, lifestyle choices, and health challenges. Regarding the methods of this study, the study population included high school students from the Sweetwater School District in San Diego County. The students applied to attend the camp in 2019 and were selected based on their grades, personal statement, and career aspirations. During the camp, the students completed a pre and post survey regarding their individual health behaviors and their understanding on the topics regarding 5210. The survey asked questions in a multiple choice format as well as free response. For the purposes of this study, we collected data based on 6 questions in the survey, where we recorded the students' demographic data, dietary patterns, physical activity, barriers to health, and health topics of interest. Once the surveys were collected, I performed frequency tables and obtained the percentages of each individual responses via SPSS software. Some of the key findings include the sample size of 16 students. When looking at the demographic data in this study, we found there to be 50% of the participants as male and 50% of the participants identified as female. In the nutrition portion of the survey, the students were asked how many fruits and vegetables they consumed in a day. They were also asked how many home-cooked meals they eat in a week. Most of the students, 62.5%, reported eating 1 to 2 servings of fruit and vegetables a day. Notably, 25% of the participants reported eating a home-cooked meal 7 days a week. When assessing the health behaviors of the survey, notably, 12.5% of the participants reported being physically active 0 days of the week, while the rest of the participants reported being physically active more than 1 day a week. 75% of the participants reported time and money as a primary barrier to them not living a healthier lifestyle. When asked the health topics they found important, 37.5% of them noted nutrition-related education to be the most beneficial. There are several implications from this project. From the surveys, we can conclude that overall, the participants were very knowledgeable about healthy behaviors and healthy eating habits. The most interesting finding involves physical activity. We found there to be 2 participants that have 0 days of physical activity in a week, while the rest of the participants reported being active at least once a week. I found this interesting because most of the participants eat fruits and vegetables frequently, yet their physical activity was very low. We found the barrier of concern to be time and money. The lack of time aspect can cause some of the participants and others in this age group to not have the spare time they need to exercise and stay active. Likewise, the lack of finances can prevent some of the participants from being involved in activities of interest that cost money. And lastly, I want to discuss some of the strengths and weaknesses of this study. Some of the strengths include that first, I felt like this project was very insightful and rewarding. I had the opportunity to not only work with a lot of healthcare professionals, but I had the opportunity to also develop my research skills and connect with some of the students. A lot of the students seem to have an interest in learning more about healthy living and how to implement the tools they learn into their life. There are very few limitations of this study. During the camp, many of the participants noted that there was a lot of information, yet such little time. The duration of the camp may have been too short, and some of the information may not have been absorbed. Another limitation of the study is the selection criteria for the students. The students had to have interest in healthcare, and they had to have a certain GPA to be considered for the program. This may have limited the number of students eligible to participate in the study. There may also be bias since the students were already interested in healthcare. I would like to thank the Western Region Public Health Training Center for allowing me the resources to help complete this project. I would also like to thank the staff at the Scripps Mercy Chula Vista Wellbeing Center and Kendra Branstein for being such a great mentor. Lastly, I would like to thank the Sweetwater High School District for allowing us to work with their students. Thank you.